Welcome to the Chew on This podcast. Join your host, Dr. Katie Chew, and her guests as they chew on what matters, one story at a time.
Welcome back to another episode of Chew on This podcast. I'm your host, Dr. Katie Chew, and today I have a fabulous guest, Dr. Huy Ly. How are you today?
I'm good. How are you doing?
I'm doing
Thanks for
great. I'm
coming.
doing great. I'm so happy that you said yes to being on this
Course,
podcast. I
course,
think
yeah.
I heard you lecture recently at a top golf event,
Yeah,
and you were gracious enough to say yes.
of
Because when
course.
I asked
Yeah.
you, would you
My
like to?
first time, so
Yeah.
pop in my podcast cherry.
Yes. Okay, so tell my followers a little bit about yourself, who you are, what you do.
Yeah, so I'm currently practicing here at Winston Eye Care and Vision in Fullerton, and as a glaucoma and cataract specialist. I was originally, I'm actually originally from Vietnam. I was born there in South Vietnam, and I moved here, immigrated with my parents when I was 6.
Mm.
And grew up in Texas in kind of the Dallas suburb area. And then did most of my school in there. Went to University of Texas. Also did my med school in Texas, and eventually I made my way to Cleveland for my residency, and then eventually, ultimately to UC Irvine for my glaucoma fellowship, and then just ended up staying here afterwards. And so I've been working full time since 2021.
Mm-hmm.
Yeah.
And what made you choose glaucoma?
Yeah, I mean,
Yeah.
out of good question. No one wanted to do it, so you know that, and out of kind of more of, so I was training during a period of COVID,
Mm-hmm.
so it was kind of weird just because obviously it was COVID, everything shut down,
And you
and
were in Texas at that time.
I was in Cleveland. It's
Oh,
my
in
last
Cleveland.
year
Oh,
of
okay.
training, so it really kind of affected at least my class pretty uh
Significantly.
yeah, pretty significantly, just because it was like their year of residencies when you do the most surgical training.
And everything was starting to shut down. Right?
Temporarily, yeah.
Yeah.
Fortunately, or I did lose a decent amount of training time, but we were able to get somewhat a schedule up to get us our numbers up, and it reasonable number before we graduated. So as a result, the job prospects coming out was just, kind of a big unknown, because still COVID was still happening when I graduated in 2020. Just stuck in the midst of COVID.
Yeah.
So as a sort of like, trying not to waste a year, and also I wanted to kind of come here, in SoCal and things like that. And
Was there anything in SoCal that
well,
was
yeah, so
like?
I failed to mention that my first year of intern year, I actually did my intern year at UCLA
Oh,
up in
okay.
Harbor. So I liked here when I got here, and then eventually I wanted to come back, but then being SoCal, as you know, you've been here for
Mm-hmm.
30 plus years. Pretty competitive to get jobs and things like that. So as a result, I'm with COVID, I'm like, well, I think um, I talked to one of my attendants, and I really didn't have a particular subspecialty in mind. But his best advice he probably gave me ever was like, oh, it doesn't matter what fellowship you do, just any fellowship will make you overall better physician. And as a result, glaucoma was the one I felt like I could probably make the most impact, um, in terms of adding to my repertoire and helping patients. And
Yeah.
my ultimate dream is to kind of do mission work and kind of help uh, go back to Vietnam and kind of do
Mm.
free surgeries and etc. And glaucoma would be, at least out of the ones that readily available, would be the most useful in terms of like.
What is the prevalence, do you know, of glaucoma in Vietnam?
It's a good question. I don't know, because I don't know if they
I
have
just
it.
know in general for Asians, it is
Correct.
pretty
Yeah,
high.
yeah. Especially in SoCal,
Mm-hmm.
and amongst the Vietnamese community, is a high incidence of narrow angle and angle closure.
Mm-hmm.
Um, so that combined, I figured glaucoma would be the best kind of suit for me, and I also kind of like the patient, at least when I was training the glaucoma patients, a little bit better, because you see them on a very regular basis.
I was going to say
Yeah,
you start to develop a relationship with each of those patients because
100%.
you're seeing them quite
Yeah,
frequently.
yeah, no, every 4 months even. So you really get to know them, and I really like that aspect of glaucoma and getting to know their family and talk about it's just kind of like seeing an old friend after a while.
Yeah.
And yeah,
Do you do some of the counseling yourself when it comes to family members, learning about glaucoma?
what do you mean by that, Lisa?
Oh, meaning like if it seems like glaucoma is pretty dominant
Mm.
within that family, do you do the counseling or do you have a staff that helps you?
Oh yes, yes, yeah. I do all my counseling education and
Yeah,
for anything that hereditary or
yeah,
family member. Yeah, yeah.
yeah. Because for me, I practice in a immigrant community.
Mm-hmm.
And so I realized that a lot of times, if I have an elderly patient, and because they're kind of still bringing back habits, bring habits to here that they have developed back in their own country,
I see.
that sometimes, it's important for us to also educate their, maybe their adult children about the condition,
Correct.
just so that everyone is informed, right? So
Right.
that better care can be, or better compliance can
Correct.
occur.
Yes.
Yeah,
Yes.
because
Definitely compliance is a big thing
yeah, yeah,
in glaucoma. Which
yeah,
drops are
yeah.
tough, and I think as providers sometimes, at least for me, we underestimate like how hard or how difficult it is to just routinely do, 3 drops, 3 times a day, or let alone
Well, and
4 drops.
especially if there are side effects to
Correct.
the
Correct. And
redness,
yeah, I know when
irritation.
personally I got LASIK a long time ago, but I had pretty bad dry eyes the first year, and I was just doing tons of drops. So I know, and I just can't imagine having to continue that
Mhm.
regimen for the rest of my life. So I definitely, that's definitely
Yeah.
a component of glaucoma. It gets tough, because you gotta balance out like you know it's easy to just tell 'em, "Hey, use this 3 times a day," but, it has such a busy life and
Oh, yeah. I mean,
remembering
and then
carrying the
sometimes,
bottles around, yep.
yeah, and I do have patients that sometimes they'll admit that they feel bad, that they have to come in and tell me
Mhm.
that they didn't really follow the regimen, right?
Mhm, mhm,
Because you think 3 times is easy, but
mhm.
sometimes
Yeah, yeah.
oftentimes they'll miss that
Oh,
3rd drop.
yeah. Oh, yeah.
Yeah.
Yeah, yeah.
And
Even
so
artificial tears that people miss,
yeah.
just something, like, very stuff
Yeah.
that's soothing, but,
Yeah.
so the hard part about glaucoma, but the thing about I like about it is, you know, generally the demographic patients are all very, very grateful and very easy to get along with. They're not, type A personality. They're very easygoing and always happy, even if their vision's not good. So I,
Yeah.
very, very
Yeah.
much enjoy that part.
But I'm gonna have to say this,
Yeah.
that has a lot to do with you too. Like,
Yeah.
meaning that you probably did help them set that mindset
Yeah.
as well. Because I think just having the diagnosis of glaucoma is a hard diagnosis to
Correct.
to
Yeah.
accept,
Yeah. Yeah.
to know possibly, with
Mhm.
end stage, right,
Mhm.
that all vision can be lost.
Correct. Yeah, you're right. No, it's a diagnosis that essentially sticks with you for your whole life, right? So it's
Yeah.
not curable, but definitely manageable and
Yeah.
somewhat. We can slow down progression a good
Yeah.
amount nowadays, with the exception of certain type of glaucoma, like narrow angles and
Mhm.
angle closure, which generally is resolved after cataract surgery. But yeah, no, I agree. But that's the the balance we
I
always.
to be honest, in
Yeah.
my opinion, I think glaucoma is probably the hardest in my
You
opinion,
think
just
so? Yeah.
because I always feel like because it for some patients when they hear glaucoma,
Sure.
it's almost like a very dire
Yeah.
diagnosis,
Uh-huh.
because they read everywhere that there's no cure for it and
Sure.
all that stuff, and so sometimes they can feel helpless, right? And but I think for you, maybe your style of being able to manage them helps them have a better mindset
Yeah, yeah,
and
yeah, most
be
definitely, yeah.
yeah.
Yeah, no, I love my glaucoma patients, but I think what I've learned, and my mentor actually taught me a little bit about this, is as more you practice, your patient population kind of gets self-filtered to like personality that gets along with you, and eventually, you kind of weed out the people that you don't get out with, like just naturally.
You know what? I think that's almost true with any practice.
Yeah.
like even for my own practice, I think that's very much true.
Yeah.
That at the end, the ones that, they might just end up falling out,
Mhm.
and then the ones that are very similar to my style
Mhm.
of treatment, they'll still be there, right?
Mhm. Yeah.
Okay, are you ready for
Yeah.
our format?
Let's do it.
Okay, so you're going to pull a question
Okay.
from the soft choose and you're going to read it out loud and we're going to both attempt to answer it.
Okay.
I've had
Ooh, it's a
Moni,
lot.
I know, we've stepped them up just to be prepared. So
Is there like
let
a
me pull.
special prize in this one?
Someone said it was almost like pulling out fortunes from
Hey.
fortune cookie.
Okay. This is a good one. What's something you've collected? I'll let you go first. And
What's something that I've collected?
I
Oh,
don't know. That could mean different things, right?
um,
Or is it like a
like,
hobby?
yeah, I'm gonna say that I currently collect T-Rexes.
Okay. Like
Yeah,
toys or
anything.
like models?
Usually they're toys, but
Yeah.
it's just anything with the image of a T-Rex.
Okay.
But my exam room is filled with dinosaurs. I have T-Rexes everywhere.
That's great.
And yeah, and that it comes from, I think I shared it with you
Yes.
earlier.
Yes.
It comes from my recovery from my double mastectomy, that my entire body posture had basically my shoulders curled in,
Right.
elbows stayed locked against my torso, and then I just had these short limbs for 6 weeks.
Mm-hmm.
And my children at that time were like in middle school, and they said, "Mom, you look like a T-Rex."
Yeah.
And that's where it came.
Yeah.
It's there was humor in it, and it did help me get through that season
Yeah.
of going through something pretty drastic,
No, I love it. Yeah. So that's
yeah,
symbolic.
it is symbolic, and also it's quite interesting. I didn't see it at that time, but a T-Rex, on the outside, um, is something where most kids think of it being kind of like a scary
Mm-hmm.
dinosaur, but at the same time, it's the the most prominent one, right?
Mm-hmm.
Where it
The well
shows
known, most well known. Yeah.
strength, and I think that imagery has given me the ability to power through it, just like the T-Rex, right? I mean, and um, yeah, it was tough. All I can say is that, when somebody ends up losing
Yeah.
a part of their body,
Yeah.
and especially a part of the body that is very
Mm-hmm.
identifiable, right,
Mm-hmm.
to who you are as a person, it ends up, it took 10 years
Yeah.
for me to finally be able to look in the mirror
Yeah.
and accept me for who I am today. Yeah. So, but yeah, T-Rex is what I collect.
That's beautiful.
Yeah. How about you?
Oh, well, yeah. There's a lot.
Do you have
Where do I
T-Rex?
start? So growing up, I've always been a big sneakerhead. That just means I essentially collected shoes and
Yeah.
sneakers. So that was a big thing. I was
Do
a
you
big.
just collect them or do you also trade them, like sell them?
I used to,
You
in college, that was kind of one of the ways I kind of made a little bit side money. I would buy shoes and sell them on eBay. Um, so I like to say I'm a recovering addict, but I slip up once or twice a month.
Once or twice a month?
Yeah, yeah, once a month, right? Yeah.
Okay, first of all, how do you
Once
find
every other month.
room? How do you find room to
Yeah.
display and
Well, a
store
lot of
them?
it's in my parents' house in Texas. So,
Oh,
but I'm the type to just wear all my shoes.
okay.
I was a big Kobe Bryant fan like all my life.
Yeah.
So I have all the Kobe's from Kobe ones all the way up to the ones he retired. I think there are 12 of them that he wore when he was playing. So I have all of them in multiple colors, and I used to play a lot of basketball, kind of growing up.
Mhm.
So I wore all of them, most of them. And then, obviously, also had Jordans and things like that. So that was kind of what I collected growing
How
up.
many do you have?
Ooh, too
Or you've
many to
lost
count.
you need to
Yeah,
do a catalog of
yeah.
them.
I mean, I've definitely toned down for like 90%. I don't flip them anymore or anything like that. But before, in college, get a pair, buy two, and try to sell two, and at least you'll break even and make a little money. And
Yeah.
I keep one. And I usually just wear it.
Yeah.
Some people will buy two, So the phrase that you used to use a lot is one to rock, one to stock.
One to rock. I like that.
Yeah, so you'll wear one and you have one stored up just in case, whatever you want to trade later
Yeah.
that's mint.
Yeah.
Uh,
So I'm gonna share something with you
yeah.
because when you said that, the first thing I thought of was in my world, it's when we go to a place like TJ Maxx,
Yeah.
and you know that if you see it and you don't buy it,
Yeah.
it's gone forever, right?
Really?
So it's kind of like you buy if you see it, you buy two of them because you know that maybe
Uh,
if you want to go back and get another one, it won't be there.
yeah.
So yeah, that's
That's
what
smart. Yeah. Could you trade them?
No, no,
What are like some high demand or high like just great deals at TJ Maxx? Like if I were to walk in, like, oh, I should definitely keep my eye on that.
it's funny. I actually watched a
Yeah.
documentary on the success of TJ Maxx. I was on an airplane
Yeah.
flight and I watched it and their philosophy is basically to have things that are there that you know that is limited.
I didn't
So
know that. Yeah.
yeah, and so it causes a little bit like an addiction
Yeah, I didn't. Yeah,
where
I know there's a big phrase that
you go and you see something and you know that if you don't buy it that moment, if you wanted to think about it and come back a few days later,
could
it
be
won't
gone.
be there. It will not
Mm.
be there. And so that's what they go off
So
of.
how
It's
do
their
they just
philosophy.
circulate it quickly, or do people actually buy it, or how do they
But
create that
in
kind of persona?
well, in the documentary, it basically said that they have these high power like buyers
Okay.
that know just how many pieces
Yeah.
to buy to put in each store. They I think they have like a whole algorithm
Yeah.
worked out, and so it's just based on. But well, the other thing about TJ Maxx is that it's not just clothing now. I
Right.
mean, they also have their extension. I think it's like home goods or
Oh
whatever.
yeah,
So
it's great.
so it's just a little bit
Yeah.
for
Now that
everybody.
I'm older, I definitely
You
I
know.
love home goods. So.
Oh yeah. I mean, especially when
And then the toys are great there, and I have like two little kids, so I
yeah.
definitely get a lot of toys
And I
there.
feel like the toys when you do go there, they're a
It,
little bit more unique. Like it's not like
yeah,
your standard toys.
it's a mixture from like different Walmart and Target all in one place.
Yeah.
And no, to be honest, there's literally times where I went there and the exact same toy I just saw at Target is a TJ Maxx for a third the price.
Yeah,
That's
definitely.
crazy.
Definitely a third.
Yeah,
Yeah, you'll find name brand stuff. And so, but what they buy is it's not closeouts. I remember they said that they buy surplus, like
like
things that
overstock.
overstock.
Yes.
Yes.
Okay.
So at least it's current.
Yeah, yeah,
Yeah.
yeah.
Yeah. It's a great philosophy.
Is now are they part of Marshalls or are they
That I don't
competitors?
know.
Okay.
I don't want to,
Yeah.
I always get them mixed up.
Yeah.
Okay. I'm going to pull a hard shoe.
Oh no. Okay.
I think we did good on the collecting one. What part of your life are you most proud you didn't quit?
Ooh. Ooh. That's a good question.
I'm going to answer this one for myself.
Okay.
What part of my life are you most proud you didn't quit? Um, being a speaker. When I first
What
got,
do you mean, like public speaking or?
well, when I first got brought on by Bosch and Long
Mm.
to be a speaker, a part of their speaker bureau, um, I just remember that I got hired for 2020, and
Yeah, that COVID.
so remember the shutdown wasn't until about March.
Correct.
So I did a few in-person presentations January and February, but I remember just working myself up for that first presentation because I just kept thinking that I was going to blank out. And my my stomach would start turning and this is all prior. This is
Uh-huh.
like maybe even 2 weeks prior to my first presentation.
Mhm.
And I just wanted to give up. I literally did. And I thought, I am not meant to do this. I'm
Mhm.
not meant to do this.
Mhm.
And good thing I didn't quit. Because
Yeah.
now it's like 7 years later.
Yeah.
I feel very
I
comfortable
know.
and
You're
very
trying to,
natural.
yeah,
Yeah.
you ran a
And so,
podcast, so
yeah, I guess
yeah.
everything was meant to be that it was
Oh
laid out
yeah.
this way. But good thing I didn't
Yeah.
quit.
I mean,
I was going to.
yeah.
Yeah. Yeah.
Yeah, man. I've heard many sayings from I don't know who said this, but you know, putting yourself in situations that make you uncomfortable is how you grow.
Yeah.
Yeah.
It did make me grow in big ways. And and so now I've learned through that experience of not quitting that I can now actually hear the confidence in my voice. You
Yeah.
know, because voice. I used to think it was just a way to communicate, right?
Yes.
But now I realize that the voice itself has a lot of power to it.
Yeah.
You know what I mean? And so now I learned that I need to be able to use it with integrity.
Yeah.
Like, you know what I mean? I can't just
Right.
say things and not have a intention behind them. So how are you going to answer
Oh yes. I mean, I would say, I mean, not to be cliche, I guess it's
it?
just medicine in general.
Okay.
Maybe I wasn't like the typical person kind of growing up. I really didn't want to do medicine in college or definitely not in high school.
Yeah. Was it your
Um,
parents who told you?
Sort of, yeah. So my mom, my
Yeah,
mom was
only a few
yeah,
choices.
yeah. It's like you can be anything you want as long as a doctor, engineer, or lawyer.
Yes, those are the
Those
three.
are funny, yeah. No, they were pretty hands off, but there's always that subconscious kind of like, maybe if you want to go, because my mom was a doctor in Vietnam.
Oh,
She was OBGYN, and that always healthcare is kind of lingering in the background. But to me, I wasn't super passionate about it, at least in college, and I actually wanted like my mindset and kind of my drive at the time, and a little bit still here now, but it's just to do something in business or finance. And
what was your major?
so originally I was gonna major in business, but I ended up switching to biology with a minor in business.
Mm.
Just out of, kind of my parents suggesting that.
Mhm.
So yeah, so I actually didn't go to med school right after. I was like, oh, let me try something else, and just about I worked
So
at
it's what they call the gap year, right?
yeah, yeah.
Was it 1 year or did you take a little longer?
I took 2 years actually. I worked for 2 years, and then I'm like, okay, well, I'll just apply, see how it goes, and I applied, and I got in, and I really didn't find my passion honestly until maybe, I would say I didn't really enjoy it until I got to residency. So throughout all of it, it's just a lot of grind. Med school was fun. I
Yeah.
actually did enjoy medical school a lot more in college,
Yeah.
just because of the way it was taught, and I had a lot of free time. I'm more of a self-directed learner, so I really didn't like going to class. But in med school, they allow for that. The lectures are recorded, and
Yeah.
lecture isn't like necessarily required. So I like studying on my own at home, watching in my PJs. So it was a nice
That's
time.
when these terms synchronous and
Oh
asynchronous
yes,
courses started
yes. No, this
coming
was right
out.
before COVID, so this Zoom and all
Oh,
that did
okay.
not exist.
Yeah.
So it was kind of
But they already had that.
yeah,
Nice,
yeah.
nice.
So I discovered that I just study better on my own.
Mhm.
So I really did enjoy medical school from that standpoint. But however, I didn't feel like I had a purpose. I still didn't know what I was gonna do until maybe first 3 months into third year.
Mhm.
Um, yeah. So I did a couple rotations. I did ophthalmology pretty early on. And it wasn't elective. It wasn't required. So I just kind of picked ophthalmology because I always had a little interest in more so in physics than anything else. And that's like, yeah, all those subjects. Physics was
Oh,
my favorite.
yeah, I love
Yeah.
physics.
So
Yeah.
as you know, optometry and ophthalmology,
Mhm.
has a lot of optics.
So I went to UCLA
Hmm.
for undergrad, and so physics they had two. How should I say it? They had one that was for life science students, and then they had physics that was for engineering. So if you take the one that's for engineering, it satisfies both. Like if you're a life science major, which I was, but my dad always said take ch- every option. I mean, everything that you choose in life, make sure that it has a backup.
Hmm.
So it seemed like if I chose the physics for engineers,
Hmm.
that was going to satisfy both ways. Like let's say I decided I wanted to go and become an engineer,
Yeah.
then I would have already satisfied that
Yeah.
requirement. But it was hard.
Yeah.
It was hard.
Yeah.
But
Yeah.
I had a great time.
Yeah.
Yeah.
And it helped you out in optics,
Yeah.
most likely.
Yeah.
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 So yeah. So that was, I mean, yeah. And then part of the hardest part is residency first year in ophthalmology. You don't know anything, and I was in Cleveland and just being in a call, and I think it was a blizzard that year. It's like -5 degrees, and um, just going in at 2 a.m. and snowing outside, and you don't know anything, and it's an open globe, and those were the hard times where I question, like, am I gonna
Yeah.
make it?
Because where you grew up in Texas, right?
Yeah,
There was no snow, correct?
rarely,
Very
yeah, like once
rarely,
a
right?
year maybe, and
And
it's
then
just
now
like
we're in Cleveland.
sprinkle, and everyone cancels school just for like
Yeah.
one snowflake, but. Cleveland was no joke.
Yeah.
And it happened to be one of those El Nino years where it's just
Mhm.
ridiculous. I remember like one call, uh, I even got a flat tire going at 2 a.m. driving to call.
Oh, gee.
Yeah, so I ended up pulling over and I changed my tire
In a blizzard like
in the
condition.
blizzard by myself, middle of like 3
Yeah.
a.m. And I'm like, oh, this was, am I gonna make it? But
Well, you did, obviously.
yes, yeah. So that probably the point where I was like, oh, I kind of want to quit, but kind of
Yeah.
glad I powered through it since,
Yeah.
as
Well,
eye healthcare is a wonderful field to be in.
it is. It is. And I'm gonna piggyback off of like because you were mentioning like passion, you didn't really know when.
Yeah,
I mean, here I've been practicing, for so many decades, right? And it just wasn't until recent that I realized that is my passion. Like I
yeah,
was doing it every day,
right,
but I didn't n- it didn't the switch didn't turn on
right.
until recently. And once I saw that that was my purpose to help patients see better, right? That just everything started being full circle because then I realized all these years they've been helping me see better and clearer,
Mm,
of myself. And so now it's just like every day I go in and it's practicing gratitude. I am so thankful for these patients that have
mhm,
stuck by me
mhm.
all these years and they're the ones that actually have kept me going.
Oh, that's
Yeah,
wonderful.
so that's my little passion thing. Okay, what was that? That was hard. Okay, you're gonna pull a
All
sock.
right.
How are you doing with your first podcast right now? Okay.
Good,
Good,
good. I
good,
just
good.
hope people find this interesting. I'm sorry, guys, if it's boring. Uh, all right. Let's see what do we have here. What's the most memorable gift you've ever received? Ooh, that's a softie. That's a hard one for
What's
me.
the most
Memorable
memorable
gift.
gift you've ever
Now, is
received?
this like symbolic gift or is it like a material gift?
Gosh, I
Right.
don't know. I can
I'm
honestly
sure there's like a
say
whole bunch, right?
yes.
Yeah.
I
Or
mean,
pick one.
especially since I have two daughters who are very thoughtful. My patients are thoughtful. I recently did a post on LinkedIn
Yeah.
of a gift that I got from two patients. They're sisters,
Okay.
and I believe they're both like engineers, and but they're also very artistic, and so they drew pieces of my life from the optometry world onto a pair of jeans.
Oh.
They asked me what size I am, and they went ahead and surprised me with a pair of stretchy
Yeah.
white jeans that they drew, like the phoropter, they drew the slit
That's
lamp, they drew
awesome.
all these the
Yeah.
eye chart onto these pair of jeans.
Yeah.
So that was extremely, a priceless gift.
Yeah.
Um, I don't know, I think that might be my answer. I mean, because there could be so
Yeah,
many other
exactly.
ones.
Yeah.
I'm
That's a
looking at
tough
the question,
one.
memorable gift. Yeah, it was memorable, definitely.
Yeah. Yeah, that's
How about you?
I'm gonna cheat a little bit. I'm gonna say two. Just I'm gonna give my
Okay.
parents a quick
A shout
shout
out.
out.
Okay.
Just not a physical gift, but obviously, we're immigrants and I'm the only child and my mom, my parents gave up a lot to come here.
Mm.
Just like any immigrant story. Just coming here, we were living on food stamps for the first 2 years and just them making that sacrifice and giving
Did
that.
you go straight to Texas?
Actually went to Kansas, funny
To
enough.
Kansas.
Yeah,
Okay.
where my aunt who sponsored us lived.
Okay.
So we lived there for about 6 months, and then we eventually settled down in Dallas. But yeah, so that's a kind of quick kind of a shout out to them. Just that gift of
Yeah.
this opportunity of being here and
Mhm.
making a better life for all of us. And then no, I guess the second one, the most recent that I can think of is probably for my birthday. My son,
Mhm.
who's 4 years old. I like to think he's actually a little brighter in his age, but so he wrote me a little card
Oh,
saying, yeah, so at 4, I was surprised to even write. So
yeah.
he wrote me a little card that said, "Happy birthday, Dada. I love playing with you." There's a little card and then it was cute. So that
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 is
to
cute.
me is at least the most recently like first comes to mind.
Yeah, so as time goes by and you watch your children grow up, um, you're gonna, have these beautiful, like,
Mhm.
repeated moments
Like your
of
daughter
where
recently,
well,
she got
oh,
the
yeah.
picture you
Yeah,
that's
you mean,
the one the picture you shared with me.
yeah, in the
That's great.
Marines,
Yeah.
and so what I'm trying to share with you is that I have a bin, that I I've moved quite a bit, in
Hmm.
recent years, and so this one bin, I'm not gonna let it go because I have things like that, like
Mm.
the card that your
Mhm.
son, wrote for you, it's these priceless little
Yeah.
artwork,
Yeah.
and it's just for both my daughters, it's in this one bin, so I'm like, "Okay, this bin needs to go with me everywhere I go."
Yeah. Yeah. It's wonderful.
It is
Yeah.
wonderful. It is
It really
wonderful.
is.
And it's nice to see these expressions at whatever age. And then,
Hmm.
like now, my birthday is coming up.
Hmm.
And so I celebrated it with my older daughter in Laguna just a few days ago. And you know, we decided that instead of buying like physical presents,
Hmm.
we now want more like experiences.
Hmm.
And so she bought tickets to this, it's called, I don't know if you've ever heard of it, but it's Pageant of the Masters. It's
No. No.
part of Laguna Beach Festival of the Arts.
Okay.
And so what they do is during the summer months, they it's a on-stage performance of actors that portray famous paintings.
Oh, okay.
So there's actors that technically it's three-dimensional, right?
Hmm.
But the way with the lighting and with the set, it looks two-dimensional, and they will portray famous paintings,
Mm.
and it's amazing.
Is it,
It's
do
spectacular.
they move or
No,
okay?
that's just
This is
it.
like they're posing.
So they have an orchestra
Okay.
that's playing, and there I don't know if you knew this, but in Laguna, Canyon, there's actually, like, an amphitheater. So it's like a little mini Greek theater, a little
Mm.
mini Hollywood Bowl.
Yes. Yes.
And so there's an orchestra that's playing, and then they will give the history of each of the different famous artists,
Wow.
and then showcase a piece on stage with the
Yeah.
actors that are not moving,
Yeah.
but they make up the drawing, the
Wow.
painting, the artwork. Yeah, it's beautiful. And so what I was going to share was that she gave me a card, and it's nice to know when your how should I say it? The things that we invest in our children,
Mhm.
when it comes back in their writing, it,
Oh,
it's really nice.
oh, it's really
It's really nice.
important.
Yeah.
Yeah.
Okay, I'm gonna pull a hard shoe.
Okay.
What's something you had to forgive yourself for?
Ooh, that was a hard one.
That's why it's part of a hard shoe. What's
Thinking
something you
about
had
that.
to forgive
Yeah.
yourself for? Mm, I'm gonna go a little bit deep on this one because it's the
Sure.
first thing that came to my mind. Um, There was a period of time, probably about 10 years, that I actually did not speak to my mother.
Oh.
And, I don't want to go into all the
Mhm.
history, but there was a reason. And so I was basically estranged
Right.
from her. Um, and then later on, I did, um, we reconciled, but only like 4 months prior to her diagnosis of metastatic kidney cancer. So, she only had 6 months to live after that. So, I had a very short window to reunite with her while she was still, you know, um, pretty much aware of everything, because as soon as she got that diagnosis, I mean, she was under pain medication, she was, drifting in and out of consciousness, and um, so I just have I've learned recently to forgive myself for the guilt that I was having
Mhm.
for not speaking to her for 10 years.
Yeah.
And, and I'm okay with it now,
Yeah.
but it took a while
Yeah.
for me to
No,
forgive
it's
myself.
tough.
Yeah. Because I obviously I was questioning whether or not I was being a good daughter,
Right.
but had to put things in perspective, and a lot of the circumstances that I made that decision to not talk to her was not because of me,
Yeah.
and it was because of circumstances.
Right.
So yeah, so I've learned to forgive,
Good. Good.
yeah, myself for it. How
Yeah.
about you?
Yeah. Not to that degree, but
Mhm.
I think similarly family involved. I believe I did carry a amount of guilt as well, as I mentioned earlier about um ki kind of not knowing what I wanted to do with my life, and um I do appreciate my parents just giving me that time to figure it out. But during that period, obviously I'm the only child, and my mom gave up her career to be here, and I wasn't doing like much with my life at the time. I was just working as a research assistant and whatnot. And I think at some point, um, as I got a couple of years, 1 or 2 years, I just felt that guilt. Like, what am I doing? As my parents kind of did all this for me to, you know, what am I going to do with my life? And I guess for the longest time, I felt that guilt of my mom just, especially my mom, just sacrificing because she could have had a way better life if she had stayed actually, because when we did go back to visit Vietnam and years later, and she met actually her old friends and other doctors like that were under her that she trained,
Mhm.
and you see how their life has become, and they're
Mhm.
super rich in Vietnam. If you're a doctor,
Mhm.
they're driving around on BMWs in Vietnam, which is crazy. That's like the tariff that you pay to get that
Mhm.
car, and say they were just driving like a 3 Series BMW, for
Mhm.
example. Oh, whatever, 30, 40,000 here with the tariffs, it's like over 100,000 in cash.
Yeah.
So no, they're super wealthy, super well off. So that was the life that essentially my mom could have had, kind of if she had stayed, it would be a lot easier than
Yeah.
coming over here and trying to make a
Better
new
living
living
for life
for
for
me. Yeah.
you. That's
So, I just felt like a lot of guilt for a while, for not being able to just wasting my opportunities here.
you
So
felt like you had to kind of return
correct,
the
correct.
sacrifice that she
Yeah,
made, right?
yeah. So that
Yeah.
that that kind of lingered for a bit, and I felt guilty for not taking it as seriously initially, or not as matured. But in hindsight, obviously, things are working out now.
Yeah.
But I probably wasn't ready if I had gone to medical school, where I go
Yeah,
originally.
I mean, and this again, this might sound like a cliche, but um things happen the way they're supposed to happen.
Mhm.
So like you said, if it was any sooner, it may have not played out the
Yeah,
way.
it's true. I might not
Yeah.
have done well, and
Yeah.
I
Yeah. I think you
would have
had
done
to
ophthalmology.
I think you had to
Yeah.
learn it for yourself.
Correct, correct,
Yeah. And I
correct,
think that's what you said earlier was like you drive yourself.
correct.
And I
This
think
yeah.
at that other point in your life,
Mhm.
you were still hearing voices from other people trying to drive you. I think,
Exactly.
and then finally you were able to
Right.
do it
It has to
yourself.
be self-directed. Yeah.
Exactly.
Yeah. You're
Exactly.
100% correct. Yep.
Exactly.
Yep.
Okay, I lost track. Was that a easy or hard?
That was a hard
Okay,
one.
so you
So it's
pull
my
us
turn.
off.
This is my third. I think it's the third soft one.
Yes.
Yeah.
After that, and then I'll pull one more hard, and then we'll be done.
Okay. Yeah. Went by quick. What's one thing you hope you never outgrow?
Jeez,
That's a
what's
fun
one
one,
thing
huh?
you hope you never outgrow? Uh, I love doing the jig, like just
What
like
is that? Is it
like a
dance?
little jig, like a little dance.
Uh,
Nothing formal, but like when I come home or if there's like something to celebrate,
hmm.
I'll just do a little happy dance. It's like a happy dance.
Okay.
Yeah,
Okay.
yeah,
Yeah.
because that's something that I used to do as a kid, and
Yeah.
I haven't given it up.
Yeah.
Yeah, yeah,
Okay.
yeah. How about you?
What was this? Actually, kind of tough one for me.
You know what? That's
I'm so immature. It's like so many, so many things. I would say my sense of humor is pretty out there. I know I'm trying to hold it in right now, but yes, my colleague is doing it right now. But
I'm already laughing,
yeah,
even though you're not trying.
yeah, yeah. I'm very dry, but sometimes I can have a very immature sense of humor. Um, but I think for the most part, it's people do enjoy it, and it's very kind of Like for example, my son, he's 4 and he's in this stage where he just laughs at anything that involves farts. So I always I'll make the Tesla fart or I'll make fart jokes with him, and we'll play him like Taco Fart is like his favorite song. So like it's like very very kind of immature humor, but
Yeah. Yeah.
sometimes you not feel like, at least maybe it's because I'm a guy, but you know that's just one of the funniest things I find in life. It's just the
Yeah.
simple jokes like that.
Yeah.
And yeah, I hope I don't get too serious one day and outgrow it. And
No, I don't think we should ever outgrow our little kid,
oh yeah, yeah.
side of us. Yeah, I love being silly. When I talk to my daughters on the phone, um, there's a there's a different voice that comes out of me. It's
Oh,
it's
yeah,
it's very I don't know how to say it, but I'm always very childlike sometimes when I talk.
yeah, yeah. I
Yeah,
forgot what the term is
yeah.
called, where you kind of I wouldn't say like arrested development, but there's arrested.
Arrested
Yeah,
Development.
it's kind of like a term, I guess. I was to show off that, but like
Yeah,
when you
yeah,
kind of
yeah.
regress back to
Yeah,
when you're in
but
that
we
same
but
situation.
yeah, but when we
Yeah,
when we talk, it's just it's very endearing. Like if
right.
anyone would hear us, we're just
I
like
know.
we're giddy and we're just yeah,
That's
yeah.
great. I'm looking forward to that. My son's starting. Now I can talk to him like a adult now, but he's starting to kind of get things, and it's starting to get funny. Like for example, I always kind of joke with him a lot, and um, I would ask him, "Hey, what do you think it's in space?" I think we're at the museum, and he's like, "Hmm." He's thinking. I was like, "Do you think there are farts up there?" And he's like laughing. He's like, "No, silly. There are planets." But it's like it's so cool that you can have
He's probably
conversations with him, and he's
he's
like
probably
correcting me.
yeah,
He's like,
he's probably
"Don't be
thinking, I
silly."
know, that's what he's thinking. Like, Dad, stop with the fart
Yeah.
jokes.
One day he'll outgrow that.
Okay, that was the
Yeah. I
okay.
think you got
This
the
is
last
the
one.
finale.
Okay.
All right, let's see what this is. We need to have a drum roll. What has life softened in you?
Oh, ooh,
What has
oh,
life
man.
softened in you? I I used to get very tense up about being late.
Hmm.
Like just
You
and
yourself or other people too?
no, just me myself. Like
Mhm.
I would put the pressure on myself. And so but somehow even with that pressure, I would still be late. Like so
Oh.
it just was
Right.
it was maddening.
It's
And
like paralysis,
yeah,
indecision paralysis.
yeah, I'm not
Yeah.
sure like why that would happen. And but now I have taken that where I just know that my intentions are always good. I'm not trying to purposely be late, but if I am late, then so be it. Meaning that at least I got there alive and safe. Better than rushing, trying to speed, you know what I mean?
Mhm.
And putting stress on myself to get there, as opposed to like now I just make sure that, I get there when I get there. Just make sure that you get there in one piece.
Mhm.
And that's the whole framing now. And it has softened me in many ways because now when I show up relaxed.
Mhm.
Whereas before, if you have that mentality where you need to be there, you need to be there, then you show up and you're a little bit late, then you feel flustered.
Right.
Yeah.
Okay.
So
Yeah,
that's
that's a good one.
yeah.
I think.
I've never shared that before, so that's kind of
Oh,
like,
okay.
yeah.
Uh, for me, I would say, just I think mostly being in practicing glaucoma, or just I guess going through life and maturity, has kind of softened me in the sense that I worry. I growing up, I used to be very kind of a little bit OCD in the sense that I like things to be done exactly like they're supposed to. And like if I build a Lego, or if I do something and there's an instruction, like I'm like, we gotta do this exactly in order. This is not what. Um. So that, and in what I learn and through life is, especially glaucoma, because it's not as such a um trying to find the right words for it, like a systematic, logical, stepwise fashion to diagnose glaucoma versus like say if you're like in computer science or engineering, you have a problem you need to solve, you need a math problem, you need to do this, do that.
Yeah,
A
like very
correct.
systematic.
Yeah, there's more discrete solutions versus just practicing glaucoma. It's definitely a then mixture of more like an art form.
I was gonna use that word too. Art.
Yeah, so you have to take into context really the holistic picture, not to be
Of that
cliche.
one individual, because
Exactly.
that may not apply to the next individual.
Right, because as you know, with
Yeah.
glaucoma, we measure pressures, and we measure corneal thickness, we measure nerve and visual field. But even then, though, you have to individualize that to the patient, and you can't, just because you see OCT or RFL thinning, doesn't necessarily have glaucoma, and you gotta think about, well, where was this? No, why? What is the basis for the average? Like, who did that? Like, why did they determine this is the average?
Oh, for the
Yeah,
pressure? I know. I have all
or
those
for like the RFL thinning,
Yeah.
right? So,
Oh, yeah.
and you got to think about, well, it's because that study was actually done in a cohort of the majority of Caucasians. So you take, for example, an Asian patient who's myopic and an RFL is a little thin. You got to think about, well, obviously we're gonna individualize it. They're not Caucasian. You can't necessarily compare it to them, and even so, you got to take into other factors into consideration, such as if they're myopic. Of course, they're gonna be naturally a little thinner because it's stretched out. Um, if their pressure is normal, is this really glaucoma, or are you just treating this just because you see some red on RFL? So like that, so you really have to individualize the treatment to everybody and take to really make a diagnosis because not everything is glaucoma.
Yeah.
Um,
Well, and when we bring up the word art, right?
mhm,
I think art is tied into experience.
correct.
Because
This is a great.
yeah,
Yeah,
because if you only go straight off of what you learned from school,
exactly.
everything is so black and white from the textbooks, it's not going to work out.
One
I
hundred
mean,
percent.
yeah, yeah, you have
Yeah, that's the lesson I kind of learned with as more I practice and definitely doing my fellowship and
hmm
because you learn that glaucoma cup point five must be glaucoma
Yeah.
or you have that early on when you're
Yeah.
studying you're like this must be this must be there's defects it must be
Yeah, or there's variations on how it would be for different patients and
exactly
different ethnic groups.
correct
Right.
yeah and that's why I really do believe practicing in Cleveland and the Midwest and here glaucoma is very regional and variable.
So how do you see it here?
Yeah, here
Is it more
it's
predominant?
it's a lot more narrow angle and angle closure by far.
Yeah.
A lot more neovascular glaucoma, and that's because of the Asians. When I was at UC Irvine, the majority of the academic patients are the patients who were on Cal Optima and went on to flow in the emergency rooms were, I'll say, 50% Vietnamese or Asian and 50% Hispanic.
Yeah.
So it's either neovascular glaucoma or enclosure on a weekly basis.
Yeah.
So that was very, very prevalent here. And then you go back to Cleveland, you rarely see those emergencies. Like I probably saw 3 or 4 NVGs or neovascular glaucoma, in the 2 or 3 years I was there, like emergency.
Yeah.
Um,
I would say
and the angle closure, like few and far between as well.
I would say almost 80% of my demographics is Asian.
Mhm.
Yeah. So angle closure is a very
Oh yeah,
real
yeah.
real thing, especially um a lot of them are high baropes.
Well, and especially with the boomer, like at least with the Vietnamese people who have immigrated, they're getting older. They're hitting that stage where cataracts are developing, like
Yeah,
my
and
parents included.
and
It's
that
like
angle just gets
exactly.
more narrow.
Yep,
And
yep.
yeah,
So that's definitely a difference and very regional,
yeah,
in my opinion.
yeah.
Yeah,
Well, thank you
yeah,
for
it was fun.
for joining me today.
Yeah,
I know you
thanks for
had
driving.
well,
Wait.
yeah, I
Yeah.
well, it was worth it. And but you had patients that you saw all day today, so you must be really worn out as
Oh,
well.
no,
So, yeah.
I'll be used to it.
You're used to it. Well, now you get to go home and play
Right.
fart noises with your son.
I'll be sick of it. But
But thank you again
yeah,
for
thank
joining
you,
me.
Dr. Sure.
All right. So, thank you to all of you for joining us today for another episode of Chew on This. As I always leave you, always see your life so clearly, live your life purposefully, and also lead boldly. So, until next time, take care. Bye bye.